Welcome, everyone. Today we'll be taking a comprehensive look at chronic cholecystitis, exploring its symptoms, underlying causes, and the latest treatment approaches. This topic is based on an article written by Dr. Rajarshi Mitra, a laparoscopic surgeon and proctologist practicing in Abu Dhabi, UAE. And we are delighted to share this important topic with you. Let's start by examining the gallbladder, a vital organ in your digestive system. This small, pear-shaped structure nestled beneath your liver serves as a storage tank for bile, which helps break down fats from your food. When you eat, your gallbladder contracts to release this concentrated bile into your small intestine for efficient nutrient processing. Now let's understand cholecystitis, inflammation of the gallbladder, which presents in two forms. Acute cholecystitis emerges suddenly, typically from blockages, requiring immediate medical care. Chronic cholecystitis, our focus today, develops gradually and is characterized by persistent inflammation, usually following a pattern of mild recurring attacks. What happens during persistent inflammation? Over time, the ongoing inflammation triggers physical changes in the gallbladder wall. It becomes increasingly rigid and scarred, losing its natural flexibility. You can see this transformation clearly illustrated between the healthy gallbladder on the left and the thickened, scarred gallbladder on the right, demonstrating how this chronic condition progressively impairs the organ's ability to store and release bile effectively. There are two primary types of chronic cholecystitis to understand. The more common calculous form occurs when gallstones irritate and inflame the gallbladder wall. In contrast, acalculous cholecystitis develops without stones, typically linked to issues like biliary dyskinesia or reduced blood flow. Let's talk about how our body signals potential gallbladder issues. While these symptoms are typically more subtle than acute cases, they're important warning signs to recognize. You might experience a dull ache or fullness in the upper right abdomen, particularly after eating fatty foods. This often comes with digestive challenges like bloating, excessive gas, and occasional nausea. A key indicator is developing an intolerance to fatty foods, where meals that were once enjoyable become difficult to digest due to reduced bile release. These symptoms can be persistent or come and go, and they're sometimes mistaken for other digestive problems. What triggers this condition? Gallstones, or cholelithiasis, are the primary cause, creating chronic inflammation through repeated irritation. Biliary dyskinesia and cystic duct obstruction are other direct causes. Key risk factors include age over 40, obesity, pregnancy hormones, rapid weight loss, family history, and diabetes. The diagnosis of chronic cholecystitis involves three key steps. First, we conduct a comprehensive clinical evaluation to discuss symptoms and medical history. Next, we use advanced imaging to visualize the gallbladder and check for stones. Finally, laboratory tests help us measure inflammation markers and rule out other conditions. Let's explore the key diagnostic tools we use to assess gallbladder health. An abdominal ultrasound is typically our first step, using sound waves to give us a clear view of gallstones and inflammation. When we need more detailed information, we turn to CT scanning, which provides precise cross-sectional images that help evaluate inflammation severity and spot any complications. For complex cases, particularly when we suspect chronic cholecystitis, we may recommend a HIDA scan, a specialized test that shows us how well the gallbladder is functioning by measuring its ability to contract and empty. Laboratory testing plays a crucial role in supporting diagnosis. While blood tests alone can't definitively diagnose chronic cholecystitis, they provide vital insights. Two key areas are liver function tests measuring enzymes like ALT, AST, and ALP for bile duct issues, and inflammatory markers such as CRP and white blood cell counts that detect active inflammation. Treatment is focused on addressing the underlying cause of the gallbladder inflammation. For patients with persistent or recurrent symptoms, the most effective and definitive treatment is surgical removal of the gallbladder, cholecystectomy. Our three-pronged approach emphasizes symptom relief, prevention of future attacks, and targeting the root cause of the condition. The gold standard for gallbladder removal is laparoscopic cholecystectomy. This minimally invasive approach revolutionizes surgery by using tiny incisions of just half to 1 centimeter, through which we insert a camera and specialized instruments. Patients benefit from less post-operative pain, minimal scarring, and shorter hospital stays, allowing them to return to normal activities sooner than with traditional surgery. For those managing symptoms without surgery, 2 key strategies are particularly effective: pain management through medications to help alleviate discomfort during flare-ups, and dietary modification. By avoiding fatty, greasy, and processed foods while maintaining a low-fat diet with smaller, frequent meals, we can help minimize gallbladder symptoms. Here are the key takeaways for your path to wellness. Listen carefully to your body's signals. Those persistent symptoms like discomfort after fatty meals, bloating, and nausea are important warning signs. Getting an accurate diagnosis involves a thorough process of physical examination, imaging, and blood work. Remember, there's an effective solution available through minimally invasive laparoscopic surgery. Knowledge truly empowers better health outcomes. When you understand your body's signals and what causes your condition, you're better positioned to take control. By seeking appropriate medical care and following proper management strategies, you can significantly improve your overall well-being. Before we conclude, let me emphasize our medical disclaimer. The information shared today is purely educational and does not substitute for professional medical advice. Please consult your physician about specific medical conditions. In emergencies, seek immediate medical attention. Remember, these materials do not establish a doctor-patient relationship. Your healthcare provider is your primary resource for medical guidance.